everyone and welcome back to our weekly Sunday 9 p.m. live video. Okay, I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Okay, so before I go on to the actual topic, of course today's topic is all about endometrial polyp. If you go through my previous videos, I do actually have done a bit of endometrial polyp here and there. I covered it under symptoms like intermenstrual bleeding. I also covered it under ovulation bleed. I covered it under a very general topic called polyp, fibroid and adenomyosis. But today I'm going to go very specifically on endometrial polyp. Okay, first of all, do you know what is a polyp? Polyp, we always say it is a small, tiny little growth. It's always very tiny. Polyps are very tiny. So this is a picture of a polyp. This is an endometrial polyp. You can see those little tiny little growth inside. This is a polyp. So polyps are usually very tiny, and you can have polyps everywhere. You can have polyps in the uterus, you can have polyps in your nose, you can have polyps in your large bowel, your intestine. They are on your skin as well. You can have polyps. Okay, so you can actually have polyps everywhere. So when I talk about endometrial polyp, I'm only talking about endometrial polyp in the uterus. And other than uterus, actually another polyp that a lot of people very worried is the polyp in the bowel, because in our intestine or bowel, if we have polyp, that is also the early sign of intestine cancer. So same with uterus. Uterus polyp has also been linked to cancer, and that is why we want to talk about endometrial polyp and its link to cancer. Okay, first of all, why do endometrial polyp come? I always like to describe in a very simple term to most people is because your period blood unable to pass out fully. Because you must understand, every month our endometrium will thicken, and then when the period comes, it passes out and only leave behind a very thin layer. But if you are unable to do so, that means there are certain spots in your uterus whereby it doesn't clear off fully and it leaves behind some endometrium, and slowly this is what we say that it can actually form a polyp over time. But why is it that some women cannot clear off all the endometrium? And this has got to do with the imbalance of our hormones. We have estrogen, we have progesterone. All women have estrogen and have progesterone, but some women have more estrogen and less progesterone. If you have more estrogen and less progesterone, then you have tendency of developing this endometrial polyp because you're unable to clear off all your endometrium during your menses. So that's why endometrial polyp first starts. Then, what happens when you have endometrial polyp? Actually, many of us, if you really look hard, we actually may have endometrial polyp as well. But some endometrial polyp are problematic and some are not. So normally when people ask me, do I need to remove my polyp? I usually say, if the polyp troubles you, get rid of it. If the polyp doesn't trouble you, keep it. Okay, why I say so? Because polyp, we only fear one thing. That is, we fear that endometrial polyp will turn into cancer. The thing is, the most important thing you need to remember, not all polyp become cancer. Okay? Only 1% of the polyp become cancer. But the other way around, all endometrial cancer starts from polyp. So all endometrial cancer originate from polyp. And so when you have polyp, we still need to worry about cancer risk. So the only thing we need to worry about endometrial polyp is the risk of becoming cancer. 1% though, but we are worried. So how do we know? So there are two things that you need to understand, that when I say it troubles you or it doesn't trouble you. So if it's going to become cancer, it's troubling you, please don't keep the polyp. If it's not going to be cancer, we can keep the polyp, right? Another situation where it troubles you is when it doesn't allow you to get pregnant. So if it doesn't allow you to get pregnant, then you have no choice. You want to get pregnant, you get rid of it. So that is why a lot of women actually get rid of their polyp when they cannot get pregnant. So these are the only two situations where we say the polyp need to remove. Then some of you will be thinking, can turn cancer, or why don't I just remove all? Why don't I just remove it anyway? Okay, you can, no harm removing, but you need to understand that polyp can grow back. So you can remove, but if the underlying problem that you have, where you have estrogen and progesterone imbalance, and you cannot clear off the endometrial lining totally during your menses, your polyp will come back. So that is why we don't just remove all polyp, because we know that I remove for you, next year you get again, what's the point, right? So that's why we only remove when we think that there are problems. In what type of situation we worry about cancer? In what type of polyp we worry about cancer? When the polyp starts to bleed, that is when we worry about cancer. Polyps, they bleed in a few ways. Number one, they can give you very heavy menses. So if you have polyp with very heavy menses, then please remove the polyp, because this polyp is troubling you and there's a risk of cancer, because cancer is always heavy menses. So when you have polyp with heavy menses, please don't keep your polyp. Your polyp may already be cancer. There is one case recently that I just operated on one uterus cancer. She actually started bleeding somewhere in June, and she actually went to see her GP, and her GP just say, you're in your 40s, you're most likely menopausing, heavy menses is normal. I was like, oh my god. So it's not normal. Her GP told her it's normal, and that is why she did not see a gynae early. When she came and see me, it was already cancer. It's a bit too late. And plus the fact, June, MCO, everybody avoiding hospitals. Don't avoid hospital and clinics just because it's MCO, yeah? We have been working throughout the pandemic, throughout all MCO. We have always been open. So don't worry when you want to come and see us. Many patients actually delay the diagnosis of cancer because they fear of COVID in the hospital. But I always tell people, hospital is the safest place to go. I worked in a hospital for 2 years and I did not get COVID. So hospital is actually the safest place to be. Besides the point, we go back to endometrial polyp. So there are 3 types of bleeding you need to worry with endometrial polyp. One is heavy menses. Heavy menses with polyp, please remove your polyp because your polyp may already be cancerous. Second, have a polyp with prolonged menses. Like your menses now is not 5 days, 7 days, become 10 days, 14 days, 18 days. Even though it's not a lot, it's just little, but more than 10 days. Even like today, there's this lady who come and see me. She said that her bleeding is horrible these 3 months. She said these 3 months very, very heavy. But when I asked her, because I look at her polyp, it's so big, it cannot just appear in 3 months. So I asked her, what happened before these 3 months? She said, all along it's normal, but my period is always more than 10 days. So it's not normal. So she has been having abnormal menses from her polyp for a long time, which she did not come and see doctor. She think that 10 days or 12 days is normal, as long as the menses know how to stop. But because these 3 months never stop, that's why come and see doctor. May be already too late. It may be already too late. Okay? Third is intermenstrual bleeding or ovulation bleed. You bleed during your ovulation period, or I would say intermenstrual bleeding. Means this little bleeding that you get not during menses. You have your menses like normal, but you have this little bleeding in between. This is intermenstrual bleeding, and a lot of people think that it's during ovulation. This is also not normal. Actually, what happens with the polyp? Polyp doesn't turn cancer overnight. It takes years. It starts from polyp to become endometrial hyperplasia. It starts with a benign polyp becoming endometrial hyperplasia and eventually becoming cancer. Normally, when it starts as a polyp, it doesn't bleed. When it starts to want to give you trouble, it will start with this intermenstrual bleeding first, which means it's the little bleeding that you get on and off. That is the very beginning of the trouble that is going to come. If you ignore this little bleeding, then it will progress into prolonged menses, which means that you have your menses, then you'll follow by little for a long, many days. So actually, it's this little bleeding that has prolonged from your menses all the way until middle of the cycle. And next, you will start to have heavy menses. And when you have heavy menses, most of the time, it's already cancer. So it's too late. So never wait until it's heavy. So normally, I tell a lot of women, out of 10 people with polyp, only 1 will bleed. The other 9 are very good ones. They have no abnormal bleeding. Everything is normal. But there'll be 1 that will bleed. It's the 1 that will bleed that we need to worry. Not everyone that bleed become cancer. Out of 10 that bleed, 1 will become cancer. So then I do not know which one of you will end up being cancer. But once you bleed, we need to remove the polyp. So the bleeding is not a lot. It's usually start little first. Sometimes you just see some little bit of blood on your discharge. And sometimes you just get a bit of brownish stain or some pinkish stain. That is the beginning. And slowly, the number of days increase and eventually it will join up with your menses, so you get a prolonged bleeding. And last of all, it will be heavy menses. That will be the last step. So we should actually do surgery to remove polyp at the point when it has little bleeding, not at the point when it has heavy menses. Then you should be safe, no cancer at all. So remember, benign polyps, which is polyps that are good ones, don't turn cancer overnight. It slowly progresses over a few years, and in between, it forms what we call a condition called endometrial hyperplasia, which is actually already on its way towards cancer. So that's why every time when we remove polyp, I always tell patients, there are 3 possible results when I remove your polyp. It's either a total benign polyp, thank God, because no problem, no implication to your health, or it can be total cancer, which is bad news because then you will need to do a lot of things after this. And last of all is hyperplasia, which is in between. Pre-cancer condition, which we call endometrial hyperplasia, which in itself has many different grades, and some are closer to cancer and some are not so. But once you have hyperplasia, you need to be on lifelong treatment already. So that's why it's very important to catch the polyp when it is at a very early stage where it start bleeding a little bit. Don't wait until it becomes very bad. So that is the situation where you have to remove your polyp. If not, just leave it alone. The other situation where you need to remove your polyp is when it affects fertility. It doesn't allow you to get pregnant. If it doesn't allow you to get pregnant, then you need to remove it. No choice, right? So this is actually a very common surgery done in a lot of fertility centers and by a lot of fertility doctors, because we know if you have polyp, you can't get pregnant, we have to get rid of it, okay? And the last thing is, just in case you get pregnant. You know, there are people with polyp who still get pregnant. They're so lucky they get pregnant. So you see, for fertility, it's again like that. Do I remove a polyp when I'm planning to get pregnant? The answer is no. If you have a polyp, you're trying to get pregnant, go ahead and get pregnant. But when you cannot get pregnant, then only you remove. You see, it's not that all polyp cannot get pregnant. No. Some polyps can get pregnant. Some polyps cannot get pregnant. So the polyps that allow you to get pregnant, go ahead and get pregnant. When the polyp don't allow you to get pregnant, then only you remove. Then the question is, if I get pregnant with the polyp, will there be problems? Only one problem. The polyp has a tendency to bleed during pregnancy. It bleeds lah, but it doesn't cause miscarriage. But it causes one problem. It causes mothers to be very, very stressed. You know, pregnant women, when they bleed, they'll be so stressed. So that's why sometimes I feel that it's the stress that made them miscarriage, not the polyp that made them miscarriage. So it's nice at times not to have any polyp. I had this one lady who had a nice polyp in the sense that she never bleed, nothing. I say, go ahead and get pregnant. And so fast, next month she tried, next month she pregnant. But then when she bleeds, she's so stressed. She go and see 1 doctor, 2 doctor, 3 doctor, 4 doctor. Oh my God. The doctor cannot change your bleeding because your bleeding is because of the polyp. So at the end, finally, she miscarried. So I told her very honestly, you're very stressed over the bleeding, you might as well remove your polyp before you get pregnant again. Because if you don't remove your polyp before you get pregnant again, then the next time you're going to get pregnant, you get pregnant so easily, so you're going to get pregnant again very soon. But you will bleed again and you're going to stress again. Because you already remember your first bad experience, which is pregnant, bleeding, miscarriage. So we don't want any more bleeding in your next pregnancy. So we don't want the polyp. Remove your polyp. Polyps are very easy to remove. Polyp is the easiest operation to do. Why? I always tell people it's just a 2-minute surgery, get it over with. Because polyps, you see, it is right inside the cavity. It's inside the cavity. So what do we do when it's inside the cavity? We just put in a scope from below and then we suck it out or pull it out. It's so simple. There are many ways to remove polyp. Some people pull, some people suck, some people cut. We also have scissors that we can go in and just cut it and pull it out. So it's so simple. And this type of operation is only 2 minutes. And then after the operation, you can still go back to work, you can do whatever you want. No pain. I don't need to even give you painkiller. There's no pain. No need painkiller. So you see, it's such a nice surgery to do. Very nice surgery to do. And last of all, the third situation where I also advise women to remove their polyp. Women who have already menopause. When you have menopause already, let's say you are already 60 years old, and you have a polyp inside. Yeah, the polyp never bleed. A nice polyp never bleed. But the problem is this polyp forever have a risk of turning into cancer. What I typically see is these women come to us when they're 80 years old with bleeding. And then you scan them, got polyp. And not all the time the polyp is cancer anyway. But when you bleed, you worry about cancer, right? Even if it's not cancer, it may be cancer in 2 years, 3 years time. Then you have to do this surgery at the age of 80. Why do a surgery? Even though it's 2 minutes, but it still involves anesthesia, hospitalization for half a day. And if you're 80, you got heart problem, you got stroke, you got high blood pressure, you got diabetes. Wow, everybody's so stressed. Family members stressed, admit to hospital, do all the blood tests, ECG, X-ray, everything abnormal. Anesthetic stress, everyone's stressed, but you still need to do it because we worry it become cancer. So my general advice for women with polyp, even though your polyp has been a very good polyp, by the age of 60, after your menopause, if your polyp is still there, get rid of it. Do this 2-minute surgery when you're still young and healthy. Don't do this 2-minute surgery when you're 80 years old. Another thing is when 80 years old, everybody is worried about cancer changes. So that's why don't do it when you're 80. Get rid of it when you're 60. Understand? Do it when you're young because we know this polyp is going to stay there and it will eventually have a risk of cancer change when you're older. So remove the polyp when you're young. Let's talk one more thing. We talk about prevention. Can we prevent? Like we say, we do the surgery today, it will grow back again tomorrow. So of course everybody wants to prevent. So I mentioned earlier just now, it is an imbalance between the estrogen and the progesterone. It's always estrogen high, progesterone low. So there's an imbalance that causes all these things to happen. So if you really want to prevent, there is one way. One way that is very easy, we depend on hormone. No? Your estrogen high, let's give you some progesterone. Makes sense or not? But unfortunately, it is long term. Because people who have high level estrogen, they tend to have long term high level estrogen. So then you end up having high level estrogen long term. So your progesterone is always low. So we have to top you up with progesterone all the way until you are menopause at least. After menopause, then we reconsider. Okay, what about natural way? A lot of people like to think, is there some natural way for me to change this? Yes. The commonest problem for high estrogen is overweight. So people who are overweight with polyp, please lose your weight. Hi, easy to say, right? Easy to say. I also want to lose weight lah. It's not easy to lose. It's easy to plan. It's easy to say. But it's not easy to do. So at the end of the day, we may need to take some progesterone long term, which is safer than, which is easy to do than losing weight. There's a lot of women, when you ask them to lose weight, it just won't happen. Forget about it. Take some progesterone. The other thing is diet. Of course, we can tell you what food got estrogen, please don't eat so much. What food got progesterone, please eat more. But you must understand, the amount of food we eat. If I tell you what has progesterone, ask you to eat more, how much can you eat? Like if I tell you yam has progesterone, please eat more. How much yam can you eat? Because you must understand, in natural food source, the amount of progesterone is so tiny. Even though in that food you have, but it's so tiny. How much can you eat? So sometimes it's nice to talk about nutrition. It is good to have nutrition as a guide for every woman. But it is most of the time not really 100% effective. So we want to top your progesterone. We ask you to eat more of these things, but sometimes it's just not easy because the list of food with progesterone is just so limited and we cannot be eating so much of all these things. If rice has progesterone, then settle, you can eat 2 bowls of rice every day, but unfortunately it's not. And the food that is high in estrogen, sometimes when we ask you to eat, you will stop eating those things. A lot of people is like, no, I cannot don't eat, don't eat, drink coffee, don't eat this, cannot. So sometimes it's not so practical. All right, so the easiest way to prevent endometrial polyp from coming back is to increase your progesterone in your body by taking some amount of progesterone, either by tablet or by putting the progesterone as an implant. Okay, your implanon is progesterone, or to put Mirena inside your uterus, which is simple. Like for me, I have endometrial polyp that was removed almost, I think, 16-17 years ago because I couldn't get pregnant. So my IVF doctor told me I have to remove my polyp. I removed. After I gave birth, I put in a Mirena and I don't have any more polyp until today. My mother also same, had polyp removed at the age of 50 plus. So you see, there is a bit of hereditary as well for polyp, because high estrogen levels tend to run a bit in family, because we say overweight. My mom is overweight, I'm overweight, all my aunties are overweight. So when we are overweight, we have higher estrogen. So that's why our polyps run in the family. So anyway, I put in a progesterone inside my uterus, so I don't have any more polyp until today. And I'm menopausing anyway, so I don't think I will have any more polyps in the future as well. Okay, so it's always easier to just use progesterone. But some women, they don't like anything that is medicine. They don't like anything that's hormones. They worry about side effects. That's fine. I respect it. No problem. Just be prepared. It will come back. No big deal. 2 minutes only. 2 minutes only. So because I always tell people, like, you go and see dentist. How often you go and see dentist? You have to do scaling. You have to do filling. You know, these are like small procedure that you do again and again and again. No big deal ma, right? It's not like you're going to do tooth implant or you're going to do root canal otherwise very major ma. You're just going to do like scaling. Scaling also need like 5, 10 or 15 minutes, right? This is only 2 minutes. So if you need to do it again, just do it again, okay? Also no big deal, right? So for people who can accept that, then you don't need any progesterone. You don't need to do anything with your diet. You just go on as usual. Have your yearly checkup with your gynae. Anytime you have a little bit of bleeding, please remember to see your gynae. And then if you say got polyp, just remove again, No big deal. 2 minute procedure. Simpler than doing a scaling. Honestly, it's simpler than scaling, because the little thing that we take out the wound is so tiny. No big deal, okay? All right. So that is how we prevent polyps from coming back. Just remember, I have mentioned a lot about endometrial polyp in my other videos covering a different aspect. So if you want to know more detail about endometrial polyp, you can still go to my YouTube channel, Dr. Tan City Clinic, Please subscribe, please like my video and turn on the notification button. And remember, go and look for topics like polyp. There's one which is fibroid polyp and adenomyosis. There's one on ovulation bleeding, intermenstrual bleeding. Go and look for all these, because all these will explain a bit more from a different angle of endometrial polyp, okay? So earlier I mentioned already, other than weight loss, actually the rest we can't do much except for using extra progesterone or increase the progesterone in your diet. There's really nothing much you can do the rest, okay? Of course, avoiding the estrogen in your daily life, but the rest, honestly, is not easy already. Normally, it is at the inner, your fallopian tube is very long. I always describe like the uterus is our body and the tube is a pair of hands. You can have at this end, yes. And usually when we do a scope, we can also see it and we can also remove it, But further away, no. With Mirena, yes, but not when without Mirena, endometrial polyp is inside the line, inside the uterus. So normally we do not remove during pap smear. So we don't remove it during pap smear because pap smear we can only do this part, we cannot do this part. So when we remove polyps during pap smear, it's usually polyp from the cervix, not from the uterus, and it's totally different. Why? Because polyps from the cervix don't turn cancer. That one no problem one. Okay, so that's all for now. Please like my video, subscribe to my channel, and turn on the notification button. Stay tuned. Thank you. Bye bye.